Okay, let's discuss hazard pay as it pertains to the HEROES Act. Now, before we get into who is actually qualified for this, we have to cover a couple things right away. First of all, this is not law. This has not passed through Congress completely. This is only passed through the House. It needs to pass through the Senate, and then the president needs to sign it in order for any of this to happen. And it is very unlikely that this is going to pass. The Senate does not even plan to discuss another stimulus package until the end of June. So this may not even happen. Now, if it does, even if you qualify for the hazard pay, you cannot apply for it. Only your employer can apply for it, and then they will pay it out to you in your regular paycheck. Now, who qualifies for this and for how much do you qualify for? It's if you make less than $200,000 per year, which is most people, you will receive $10,000 maximum. If you make over $200,000 a year, you cap out at $5,000. You won't receive any more than $5,000. Now, the way that it works is that it pays $13 per hour extra for each hour that you have worked, going all the way back to January 27th. And then it would also end 60 days after the last day of the health emergency. So this is the actual wording inside of the HEROES Act. That's what you're looking at here right now with me. We are all the way down on page 1534 before we get to this part regarding the hazard pay, which is not actually what it's called in here either. So who is it that qualifies? What does essential work actually mean? And that's what we're going to go a little more in depth here. So this is going to pertain to, so you can see right here, this is, if you're teleworking from your residence, you don't qualify. It has to be in-person interactions with patients, the public, or coworkers, or you are regularly physically handling items that were also handled by patients, the public, or coworkers performing the work. And if you work in any of the following areas. So let's cover these. This goes on for a while. This is like, I believe it's like 17 pages of worth of explanation of who is considered essential in under these terms. So first responder work, obviously, whether it's public or private. So if you respond to emergencies, then this applies to you. Healthcare workers that are performing inpatient settings such as nursing homes, rehabilitation facilities, other related facilities, including hospitals. Healthcare workers that are in outpatient settings. This means that it's physician offices, health centers, clinics, okay, many other places that this applies to. Also pharmacy work. If you work in a pharmacy, this applies to you. If you do any medical testing or diagnostic services, this applies to you. Home and community-based work, home health care. If you go and take care of people in their actual residence, this applies to you. Biomedical research, this applies to you. Behavioral health work, if you have to physically interact with individuals for mental health, substance abuse, this applies to you. Nursing care and residential care, this applies to you. Child care services, in-home child care services, nannies, social services work, if you're working in person with people, public health work. Here we go. Outside of healthcare, grocery work. If you work in a grocery store and you are handling the merchandise, you are working with the public, this applies to you. Restaurant work, including the carry out and drive through or delivery. Food production, This includes agricultural work, fishing, forestry, ranching, processing, canning, slaughtering, packaging, baking, butchering. All food production work is considered essential and would qualify for hazard pay. Transportation, if you work in public transportation. Also, private transportation, air, by train, bus, taxi, personal car, non-motorized vehicle, that you also qualify. Transport of goods, transport of mail or packages, so like FedEx, UPS, DHL, obviously the US Postal Service as well. I believe they even have their own section coming up here. Any services as an aircraft mechanic or technician who performs maintenance, repair for aircraft. Same as with maritime workers. Let's see, we are down to page 1543. Still looking at maritime transportation workers. Work physically performed in a warehouse. So if you are picking and sorting, packing and shipping, this applies to you. Cleaning work, janitorial work, maintenance work, this applies to you. If you work in the collection, removal, transportation, disposal, of waste, recycling, this applies to you. You work in the gathering or processing in news. You're working in news, television, radio, newspapers. You're considered essential, and you have to be interacting with coworkers in person. Then this is going to apply to you. Educational work, laundry work, laundromats, laundry services, dry cleaners, those who work in elections, physically at polling places, hazardous materials and cleanup and handling, disinfection work. Again, work in the clinical research and development and testing of response. Working in a mortuary, a funeral, cremation, burial, cemetery, that's considered hazardous. Physical interactions with patients in physical therapy, dental care work, work performed by employees of the US Postal Service. I thought they had their own line. You work at a hotel or commercial lodging facilities that are used for mitigation and containment measures. So I think we may have reached the end of their very specific definitions, but then they also have in general here. Also, immigration status. This applies regardless of the immigration status of the worker. They also go further to define the employer, and then talking about how much to make per year. Now, again, this has not fully passed. This still needs to go through the Senate. It is not likely to happen. They will not even discuss this until the end of June, and they are looking to create something completely separate because of everything else that has been pushed into the HEROES Act. I mean, guys, this is 1,815 pages. Obviously, this is about more than just a stimulus package and, hazard pay for essential workers. There's a lot in here. I'll link in the description below what else is in here that really actually seems very unrelated to, a crisis relief package, and is the reason why the Senate is like, no, we're not passing this as is. Will hazard pay make it into whatever they do pass? Because they do say they are going to do a fourth stimulus bill by the end of June. They're going to discuss and create this. Will this make it in there? We won't know until they actually begin discussing it, unfortunately. But as it stands right now, this is what is written with regards to hazard pay to the essential workers.